So second stage implant reconstruction involves removing the tissue expander, reshaping the pocket, and then putting a new implant, the actual implant. And usually for breast reconstruction, we use silicone implants. Saline implants for breast reconstruction is not a great idea. You'll see the rippling of the implants. It's going to feel very firm, almost like the tissue expander. So silicone implants are generally used for the reconstruction. Whether or not we do both breasts or we're doing the implant reconstruction on one breast and then matching the other breast, either with a breast lift, breast reduction, with or without an implant placement for balancing, the risks of the procedures, besides general risks of bleeding, infection, wound complications, there is the risk of implant failure. Implant failure is defined as anything that requires the implant to be removed. That's generally due to infection, implant exposure, or the other one is for capsular contracture or discomfort. And what happens when we put an implant is your body's going to form a scar capsule around the implant, which is normal. It always happens, but every time you do that and you have a capsule, sometimes the capsule can get distorted. It can distort the breast. Sometimes it can become firm, become painful. Those are called capsular contractures. And in severe cases, sometimes we have to go back in, take out the capsule, take out the implant, and then replace it. That risk is significantly higher in patients who've had radiation. The other risks associated with the procedure, especially when you're doing an implant reconstruction on a unilateral on one side with something else on the other side, there's a risk of asymmetry. When you're matching a reconstructed breast to a non-reconstructed breast, it's kind of like we say taking an apple and an orange and trying to turn them both into something else that looks the same. But there's always an asymmetry. We say they're supposed to be sisters, not twins. We want them to be sisters, not cousins either. The goal is you are not going to leave the OR till I'm happy that they're as twin-like as possible, but then they could heal asymmetrically. Aside from those risks, there's also the risk of a seroma, which is a fluid collection. You'll have drains in. When we do the second stage implant reconstruction, very often we'll put another piece of alloderm in to thicken the capsule and minimize the risk of rippling. But that new alloderm has to adhere to the existing tissue. You can get a fluid collection, so try and avoid any twisting or that can create shearing forces that creates fluid. There is the risk of rippling with the implant reconstruction. Very often when we do implant reconstruction at the second stage, we will add another piece of alloderm, an extra thick piece of alloderm to minimize the rippling. Sometimes we'll do fat grafting, but most of the time we'll do the extra piece of alloderm, as that has been very effective at minimizing the risk of rippling. There's also the risk of scarring. The risk of scarring is 100%. You will have scars. The only thing we can guarantee about the scars is that you're going to have them. But with these risks, again, you're not going to leave the OR till I'm happy that they're as twin-like as possible, but just bear in mind that there is always the risk of needing a secondary revision procedure.